Hi everyone, and welcome back to another video, this time about quadriceps injuries. Now, the quadricep muscles are a group of 4 muscles that sit on the front of the thigh. They're made up of 4 muscles called your rectus femoris, your vastus medialis, your vastus lateralis, and your vastus intermedius, which are their sort of official names, but collectively known as the quadricep muscles. Their main job is that they lift your knee up towards your chest if you're sitting. They flex the hip, and they also straighten the knee, like if you were going to kick a football, for example. Quadricep injuries are most common in sort of exercises or movements that put them under a bit of stretch and very quickly. So very similar to if you've seen my last video on hamstring injuries, really common mechanism of injury, or really similar mechanism of injury. Not the same position, but the same type of movement, so overstretching and very quickly. So the position that usually gets quadricep injuries or affects the quadriceps is more of a lunging type position, so bringing the leg back behind you and also flexing the knee slightly. So with all muscular injuries, they're categorized into 3 categories: grade 1, 2 and 3, and each grade depends on how torn the muscle is. So a grade 1 tear is a very minor tear to the muscle. Grade 2 is a more significant, or what's considered a partial tear to the muscle, so still some of the fibers are intact, but there is a significant amount of them that have torn. And then grade 3 is a complete rupture, where all of the muscle fibers of a particular muscle or muscle group have torn. So with grade 1 muscle tears, you'll get pain at the time of the injury, and you'll also get a bit of tenderness to touch around there. It'll be a bit sore to have a feel around there, but you'll still have full function of the muscle. You'll still be able to straighten the knee, you'll still have the same strength in that leg. Grade 2 injuries or muscle tears are very similar, but you'll have more pain and more tenderness around the area when feeling around there. You'll also get some bruising and maybe some swelling as well, and you'll also get some reduction in the strength of the muscle. So for example, if it's a grade 2 muscle tear of the quadriceps, you might find that the knee can't take your weight, or your leg can't take your weight when you stand on it, because when you're standing, the quadriceps keep the knee straight so it doesn't give way. If some of those fibers have torn, then the knee might give way. And with grade 3 muscle tears, you get severe amounts of pain and really sore to touch that area. You often get an associated sort of popping sound, or you feel something go, is often what people say, and you'll get lots of bruising and lots of swelling around the area, and you will have a complete loss of function of the leg. So again, if it's the quadriceps, you won't be able to straighten the knee. You'll have a complete loss of function there, and the knee will give way. So similar to with hamstring injuries, within the first 2 to 3 days, what you should do is you should rest as much as you can, or not go and do any exercise that might make it worse. So again, if it's quadriceps injuries, don't go to the gym and start doing knee extensions or leg press machines or squats. That's just going to make it worse and potentially tear it further. If it's a grade 1 or 2 tear, rest it for the first couple of days, 2 to 3 days at most. Go for a walk just to stimulate a bit of blood flow and get it moving a little bit, but don't go for a run. Nothing that intense. You should also ice the area. That helps bring down the swelling and also bring down the pain as well. It desensitizes the area very short term, which can be quite soothing for it. You should also try and compress it. Again, it helps with swelling management, and which can help with speeding up the recovery in those early days and managing the pain as well. To help with compression, with particularly the quadricep muscles, sports leggings or compression tights that you can get that some people wear running, really good for helping managing that. And also elevating it is the last thing you should do. Again, helps with draining any of the blood that comes out of there if you've torn any blood vessels around there. Any small blood vessels, helps with the bruising and helps with the swelling. Also, in the first 2 to 3 days, there are some things to avoid. The first one being heat. Don't put any heat on there, no hot water bottles, nothing like that. That'll just be aggravating for it. Probably won't find it very soothing at all. Might make it a bit more sore because it opens up the blood vessels, so it might affect the bruising and swelling as well. Also avoid alcohol in the first 2 to 3 days. Again, what alcohol does is it stimulates more blood flow to the area, which can increase the swelling, which is not what we want. It can be quite painful, especially if there's a lot of swelling already. You should also avoid any activities that'll make it worse, so things like running that we mentioned earlier, and you should also avoid massage for the first 2 to 3 days, mainly because it will be really sore. If you've just torn the muscle in the morning and then the afternoon you go to have a massage, you're not going to get any benefit from it really at all, and it's going to be really painful because someone's pushing on a newly torn muscle. Give it 2 or 3 days and then you can have some gentle massage the area. Don't go and have a deep tissue sports massage after 2 or 3 days, because again, it's going to be really sore. Just gentle, whatever you can manage. It's not essential for recovery, but it can be quite soothing if done properly after 2 or 3 days. After those first 2 to 3 days, you should look at starting to introduce some sort of rehab. So nothing extreme, just some really gentle mobility exercises, stretching and strengthening exercises. And I'll leave a link in the description to my Instagram page where I've actually covered some exercises to work on the quadricep muscles that can help with rehab after an injury. They're quite varying degrees of intensity, so start with the easy ones and then work up to more challenging ones. So how long do quadricep injuries take to get better? And it's all dependent on the grade of the tear and the individual to a large degree. But with grade 1 muscle tears, where it's a slight tear in the muscle, generally they'll be better within a couple of weeks. With the right sort of rest and mobility exercises and a slow return to the activity that you want to do, and a gradual return to it, then you should be absolutely fine and pain-free within a couple of weeks, if done properly. Grade 2 muscle tears take a little bit longer. Generally, you're looking at between 6 weeks and 3 months, depending on what you want to get back to and how committed you are to the rehab as well. So, if someone wants to get back to something that's not very quadricep heavy, or not very explosive, we should say, so something like swimming, which is generally, as long as it's leisurely swimming, is quite low intensity or low powers needed, because it's not a sudden movement, it's repetitive movement of the quadricep muscles. Whereas if you go for something like sprinting, which is maximum effort, that's putting the quadriceps under more stress, so it needs a bit more rehabilitation to get to that point. And with grade 3 muscle tears, where there's complete rupture, it can take even longer than that. Not always needing surgery to reattach those muscle fibers that have become disconnected. Sometimes they can put you in a brace to bring those muscle fibers closer together and they'll knit back together on their own. It depends on how far apart those two parts of the muscle are and whether that's possible. Usually what you find is they have a pretty similar outcome a couple of years down the line. Somebody who's had surgery and who's not, but the recovery is a little bit longer if you don't have surgery in the short term, really. But usually you're looking at closer to sort of 18 months, 12 to 18 months to get back doing any sort of sport or running, and that'll be a gradual process of slowly increasing the intensity of the exercises and going through lots of physiotherapy to get to that point. So I hope you found this video on quadricep injuries helpful. If you did, please leave a like and subscribe, and let me know in the comments if there's anything that I missed or anything else that you wanted to know about in regards to quadriceps injuries, or if there's anything you want me to cover in the future. I'm more than happy to go through it. And if you have any further questions about it, again, leave a comment and let me know. All right, thanks everyone, and see you in the next video.